etching is basically using liposuction to contour your abdomen to appear to have muscular definition, okay? This is done by doing different layers of the fat and removing different layers of the fat in different areas to appear like you have muscle definition. And the most important thing to have a good outcome for this is that you have good skin quality and the distribution of muscle and mass is in your favor. So basically there are three types of body types. The first one is called endomorph. Endomorph means that the amount, and this is just genetics, right? Like this, we can't control much. There is some factors that we can control to kind of shift it more to the mesomorph or ectoform, but it's really more of a genetic predisposition to where we keep our fat and how our muscle develops. So the endomorph is people that have a more fatty distribution, either in the subcutaneous space and or visceral space, and less muscle mass. For this type of patients, ab etching is not great. It's better to do a basic or a soft etching because it's not going to match the rest of your body. If you have a lot of visceral fat, then your body is going to have a protrusion of your belly. And if you have a protrusion of your belly and then you have a six-pack over it, it just doesn't match and it looks very made up. So that's not the goal here. The goal is to do an etching that matches the rest of your body so it enhances your musculature and you look more fit, but that matches your arms, your legs, your face, okay? So in an endomorph, we're gonna ask you probably to start working out, to start building the muscle mass, to shift this from the muscle mass to increases and decrease the fat content in your body or the fat percentage, okay? To try to get you to a mesomorph or ectomorph. A mesomorph, it's the middle ground, right? It's people that have a little bit more muscle mass, little less fat distribution, but still have a fair amount of thickness when you pinch, so the percentage of fat, it's not very low. But in those cases, you're good candidates, if the skin quality is good, to do a basic or a moderate type of etching. And I'll go over what are the differences in between those, okay? And we have the ectomorph. The ectomorph is the type of patient that has a lot of muscle mass and very, very few percentage of fat. In those cases, they're good candidates to do a very extreme ab etching to kind of bring those out, but not too much of fat transfer if that's something you're looking for, because they have very little percent of fat in their bodies. So the amount of fat you're going to get from the liposuction is very, very little, okay? So these types, like I said, are good to try to focus or guide us into what type of etching is better to each patient. And there's basically three types of ab etching. What we're trying to do is resemble the anatomy of the abdominal wall. And this, I'll go very, very simple. The linea alba is the midline. The linea semilunaris is the sides, the side triangle here. Sorry, let me do this a little smaller. This is the belly button here. So this is the linea semilunaris. So on a basic, is basically kind of creating these shadows of the linea alba in the supraumbilical above the belly button. Linea alba, semilunaris above the belly button. Very, very mild shadows, but not a very sharp definition. And this can be combined with a 360, of course, to get you that definition, provide a tighter waist, more definition in your back, and it can be combined with fat transfer if you're looking for more of an hourglass figure. In males, it's same concept as this is more common in females. Why? Because males try to look for more of a masculine torso and more muscular. So it's very rare that we do a basic on a male, but it's very common that we do a basic on a female, okay? Because if the female is not very athletic, they want a little bit of definition, but it doesn't look very sharp, that doesn't match the rest of their body, okay? In terms of the next step, it's a moderate. So the moderate is great for both, for females and males. Females that are a little bit more masculine, more muscular, sorry, and that want a little bit more definition, it does the same too as the basic, right? The linea alba and the semilunaris, and adds more definition on the sides to get the obliques and the transversus abdominis muscles kind of defined here on the sides, okay? It is very good, like I mentioned, for more athletic females that want a little bit more muscular appearance in their torso, and for males that are not very muscular but still want some definition but still don't want to look like very ripped and very demarcated. Maybe for a type of mesoform male, this is a good option, okay? So, and then we have the extreme. The extreme is really for mesoforms that want to go to the ectomorph category, or people that are already in the ectomorph, very muscular definition. So we achieve more of a definition in the abdominal muscles, not only in the linea alba, semilunaris, transverse, and obliques muscles. It does also more definition in the upper lateral abdomen with the serratus muscles here, and also the inscriptions of the six-pack muscles there, and there, okay? So it gives a very, very muscular appearance. And why is it important, again, that you are here or here? Because we don't want, definitely, we do not want to do a ninja turtle in your belly. So if you have like a big belly and then we put some squares there, that's gonna look terrible. It's not gonna match your body and it's not gonna look good. We want to kind of enhance that muscular definition that you have from baseline and kind of pop it up with those transfer inscriptions, the serratus, the oblique muscles, okay? It is very, very rare that a female wants this type of definition, but there are some females that really like to work out and look more muscular, and they are good candidates also for the extreme definition ab etching, okay? I keep on repeating the skin quality as an importance. Why? You remember that I mentioned that what I do when I'm doing this definition is basically I am creating different thicknesses of the skin in the subcutaneous space. So I am emptying the fat a little bit more in certain areas to create that shadowing. If you don't have good skin elasticity and the skin doesn't retract back, you're not going to notice anything. The skin is going to sag and you're not going to notice that definition that was created, okay? So that's why it's very, very common that we combine ab etching with energy devices, okay? For a basic and moderate, we can just combine it with either or, right? With body type or VASER. I do recommend VASER for all my cases because VASER not only has the ability to improve the skin retraction, but also decreases bleeding, decreases bruising, swelling post-op, and the recovery is better. So I always recommend the VASER if you're gonna do a basic etching. If you're gonna do to moderate to extreme, it's better to either combine or add body type. Body type is very good for the dermis. The dermis is very good. It's needed to contract, especially in the lines that we're defining. So the combination of these two energy devices, VASER, which is the ultrasound energy, body type, which is radio frequency energy, they're both energy devices. They both try to improve collagen production to improve the skin retraction, but they work in different ways. So that is why when we're looking for an extreme, moderate to extreme definition, that we really want that skin to retract so you can see that definition, you should consider adding an energy device so you can really see the results, because if not, if the skin doesn't retract back, you're not going to see those different layers, okay? And the post-op. The post-op is, I think, one of the most, the pre-op, because you have to kind of prepare your body and switch this percentage of fat and muscle mass in order for you to be a good candidate and to enhance those results and to match the rest of your body. But the post-op is very, very important because I know I've said this multiple times, but the skin needs to retract for you to see something. And if the skin doesn't retract, you're not going to see anything. So the massages and compression afterwards is even more important than with a regular liposuction, okay? Massages are going to be focused and trying to get that skin in those inscriptions, in the linea alba, and the semilunaries to kind of retract, avoid fluid buildup in those areas. And the compression is trying to get that skin to adhere to the underlying musculature so you can see the difference in thicknesses and you can see the etching results, okay? Massages should start as soon as the next day. I always mention this in my videos and lives, but I'll mention it again because I think it's important. A lot of people ask how many massages. We have the rule of 3 7s, okay? And 7 times 7 times 7, that equals 21, right? We usually say that we recommend 20 massages in the entire post-op course, so we divide it in 3 7s. The first 7 every day. So the first week you're gonna be getting 1 massage every day. The second 7 you're gonna be getting every other day. So for the next 2 weeks, that's already 3 weeks after surgery. That second week you start every other day, and that's gonna last for 2 weeks. And then the last 7 is every day. So you're gonna be getting 21 massages in the entire post-op course, and it's probably gonna last you for like 6 weeks, 8 weeks of the entire post-op process, okay? The compression is 6 weeks at all times with foams, okay? The foams are to protect your skin. They go directly over your skin, and then you put the faja over it. And then at 6 weeks, you go down to 12 hours a day until 3 months, okay? That's pretty much it. Of course, after 6 weeks, hit the gym, okay? In order to maximize his results and for you to see long-term that this definition was worth it, you have to build it in the gym, okay? If you go back to eating the way you were eating or not maintaining your results, you're not gonna see that definition, and you may have some lines in the belly, but the areas that the fat was left may look chunkier. The arms and the legs are not gonna match the belly, so your results are not gonna be long-term, okay? So it's very important, and after if I recommend etching to someone, I always tell them, are you committed to your post-op regimen? I think that's the most important thing for you to answer yourself. Am I really committed with my lifestyle changes that it's long-term, so this lasts long, okay? I'll take some questions now.
Okay, well, this is not a question, it's just a comment. Amazing surgeon. My husband says she's a wizard.
Aw, thank you.
Okay, I scheduled my surgery for next year. Lipo to the flanks and extended tummy tuck. I'm excited.
Awesome, super excited for you.
Yes, vamos a español.
Okay.
Tengo tummy tuck pronto y los nervios me tienen la presión alta. Es muy peligroso un tummy tuck.
En realidad, los procedimientos estéticos, quirúrgicos, las complicaciones en todos ellos son bien bajitas. El tummy tuck, lo que pasa es que el riesgo de formar coágulos es un poquito más alto que el de los otros. No quiero que te asustes y pienses que es un procedimiento que tiene mucho riesgo. Cuando los comparamos con otros procedimientos que van adentro de nuestro abdomen, como sea remover la vesícula, remover el apéndice, todos esos procedimientos van adentro del abdomen, pues el riesgo es mucho más alto que esto, que no estamos entrando al músculo, que no estamos entrando a la cavidad abdominal. Así que, ¿verdad? Te quiero calmar en ese sentido, que sí, o sea, es un procedimiento quirúrgico, pero no conlleva los mismos riesgos, no te tienes que quedar hospitalizada ni nada de eso, te vas para tu casa el mismo día. Lo que sí que es sumamente importante, tu recuperación, y eso lo vamos a estar hablando en el cuidado preoperatorio, en la evaluación preoperatoria y en la evaluación postoperatoria, lo seguimos recalcando, que es sumamente pararte a caminar, que es sumamente seguir todas las instrucciones de usar las medidas de compresión, de hidratarte bien luego de la cirugía. Y lo más importante para mí es que, y lo más importante para bajar la ansiedad que he visto en todos mis pacientes, es que estás haciendo lo que debes hacer. Educarte, tener toda la información en tus manos para que así puedas controlar ese nivel de ansiedad, porque ya conoces todo y sabes lo que esperar.
What type of anesthesia do you use for your procedures? Y si la puedes hacer en español también, porque
Okay.
está dos veces.
Okay, so let's start in English. I use general anesthesia for all of these cases. I think it is safer than local anesthetic. And I'll put two things that can be very unsafe or the complication rate is higher. With local anesthesia, you have to infiltrate lidocaine in the tumescence. And when we're doing ab etching, for example, in a 360 is the entire torso. So the volume of lidocaine is very high. It has been shown that when we do these procedures with tumescent and lidocaine in it, the absorption, you're not injecting it in the vein or in the artery, right? You're injecting it in the tissues. So the body's going to absorb it with time. For the maximal or the peak in concentration of lidocaine in your blood is actually 8 to 12 hours after it was infiltrated. Majority of the procedures are done how? Ambulatory. So 8 to 12 hours after your procedure, where are you? At home. You're not being monitored, and the risk of having arrhythmias and other complications from the lidocaine is high. So I don't put lidocaine in my tumescence because you're asleep. We don't need to be managing your pain locally. We manage it through the vein, okay? And the other reason is the control of the blood pressure, volume, and vital signs. It is more efficient when you're under anesthesia than when you have local anesthetic and you have to be regulating your breathing and regulating your blood pressure through it. So I do all these procedures under general. Of course, I'm going to ask you for blood work, EKG or checking your heart, medical clearance to make sure that you're healthy to tolerate general anesthesia.
Okay, how to determine if you need arm lipo or just an arm lift?
Good question. Basically, if you have mild degree of skin laxity, you are a good candidate for lipo with maybe body type or VASER to aim on skin elasticity. If you have moderate to severe skin laxity, right, you put your arm and it kind of droops down a lot from your arm, then you're not going to have a good result with lipo. Actually, it'll make it worse. It'll make it sag more, and it's better to do an arm lift. The easiest is go to my website, virtual consultation. It's free. You just send us a picture, and you fill in a form that kind of asks about the procedure that you want to do, and we let you know what I recommend, if it's either lipo or an arm lift.
Please explain how you determine if a patient needs an extended tummy tuck.
Extended tummy tuck is basically if your fold of skin goes past your little bones here that you palpate on your hip. If your fold extends all the way to the side past that bone, then you would need an extended tummy tuck. If you sit down and you go like this and that fold extends past this bone, then that's an extended tummy tuck.
Okay, and ¿podría hablar del tamaño de la cicatriz del tummy tuck?
Okay.
He visto que hay diferencias en tamaño, almost the same person.
Yeah, pero más o menos la misma pregunta, pero ahora en español, que cuán larga es la incisión, y va a depender de cuánto exceso de piel tú tengas. La forma más fácil es si tú te sientas, o si estás parada y tienes un pliegue de piel, básicamente la incisión va a ir hasta donde termina ese pliegue. Si tú te sientas y te alas hacia abajo y ese pliegue se extiende después del huesito de la cadera, eso significa que vas a necesitar un tummy tuck extendido para poder quitar ese exceso de piel que se va un poquito más lateral. Bueno, muchísimas gracias por sintonizarnos. Thank you so much for logging in, and really wants me to remind everyone to have a happy 4th. Enjoy the holiday, stay away from fireworks and all the things that can burn your hands or explode, okay? Stay away. 4th of July is the busiest in the burn unit and the hand trauma because of this. I've done a bunch of those. So do not do that. Enjoy it with family and friends. Take care. I'll see you guys next week in Tuesday Tips.
Okay, thank you. Tuvimos un... Yeah. Yep.